Tonight, the Centers for Disease Control and Prevention reports suicide deaths have jumped by 24% since 1999. Suicide is now the second leading cause of death in young people between the ages of 15 and 34. But why? The Fox Medical Team's Beth Galvin takes a look at the reasons.
We're seeing the highest jump in suicides in two groups, and one is young girls between the ages of 10 and 14. The other is middle-aged men. So I sat down with a psychiatrist who heads up Skyland Trail, a mental health treatment facility here in Atlanta, to talk about what he thinks might be driving this jump in suicides.
It really troubles me.
And Skyland Trail's chief medical officer, psychiatrist Dr. Raymond Kotwicki, believes there are two key factors playing into why we're seeing this jump in suicides in America.
One is having a mental illness for which you don't receive treatment is a real risk factor for a suicide completion.
Dr. Kotwicki says there are proven effective treatments for brain disorders like depression.
But my concern is that the stigma that goes along with saying, yeah, I'm somebody who has a mental illness, prevents people from engaging in getting that treatment.
And while we know that community and strong social connections are protective,
the sense of feeling like you actually matter or that you actually belong to a community looks like it really is plummeting.
Because screen time is increasingly replacing face-to-face communication.
And I don't think that there's a replacement for having a real-time in-person conversation and making eye contact, and something that a lot of especially young people can use to say, you know, I'm going through a tough time, but I know that there are people who have my back, who care for me, and therefore I'll be able to be okay.
Finally, Dr. Kotwicki says substance abuse also plays a major role in suicides. The CDC says most people who die from suicide are intoxicated at the time, either with alcohol, opioid pain medication, or other drugs.
My imploration of everybody is to talk about it openly and using the candid and direct words.
And by asking someone if they're thinking about suicide, Dr. Kotwicki says you are not planting a seed in someone who isn't already thinking about it. And often, he says, it's a relief to have these feelings out in the open. For the Fox Medical Team, I'm Beth Galvin.